that utilizes two separate wavelengths, a diode for coag heat energy and an ablative erbium laser. It utilizes them both at the same time for vaginal rejuvenation. We had the privilege of being the first clinic to utilize and to help create this technology several years ago. We've treated over 400 patients with diVa, and we've had outstanding results. So what are we treating when we treat for vaginal rejuvenation? It is no secret that vaginal childbirth is a traumatic event. It's a traumatic event for the pelvic floor, the connective tissues, the muscles. Sometimes it leaves patients with changes for the rest of their lives. What we hear from our patients when we talk to them about sexual function is that even though they may not be able to say exactly what's happened since they had children, but they'll say, you know, things have just never quite been the same again. And we talk a lot with our patients about sexual function. What we find is that vaginal laxity after childbirth leads to decreased sensation and sometimes decreased ability to reach climax, which can lead to decreased libido. There's also pain sometimes with intercourse for various reasons, but urinary incontinence, weakening of the pelvic floor, lack of lubrication. These things are seen with age, with lack of hormones, as sequelae from childbirth injury. We also see urinary incontinence and pelvic floor laxity as a result of chronic straining conditions, lifting weights, chronic cough, chronic constipation. So these are things that are hard to treat with the modalities that have been out for a long time. In other words, you may have tried Kegel's exercises to strengthen the pelvic floor. You may have been doing those for years with little improvement. You may have tried over-the-counter herbal remedies to improve libido. You may use over-the-counter lubricants to help decrease pain and increase lubrication with intercourse. So what is very new on the market is vaginal rejuvenation, and you may have been hearing a lot about it. So the technology that I personally feel is the best on the market is with diVa by Sciton. We have the ability to do a procedure for you that can be life-changing in less than 4 minutes with very minimal discomfort, requiring no downtime. What have our patients seen with this treatment? Improvement in lubrication, decrease in pain with intercourse, increased sensation with the increased ability to achieve climax, decrease in vaginal laxity noted by the patients and their partners, as well as an improvement in urinary incontinence. So there are new things right now that we can offer you here in our office that are way different from traditional surgical therapies, which may or may not work and may or may not have complications and problems of their own. So please visit our website or give us a call. You can learn more about diVa by Sciton by visiting with us for a consultation. But just real briefly, let me tell you how the machine works. An ablative laser is something that fires an energy into any tissue and leaves an empty channel or an empty hole that has to be refilled. So let's say, as an analogy, we talked about your yard or golf course green that is having plugs taken out of it, and it leaves empty holes in the surface that need to be refilled with new root system and covered with new grass. An ablative fractional laser treats in the same fashion. When we treat on the face and we have multiple tiny channels through the epidermis and dermis and down into the deeper tissues, those channels are filled with collagen. And then new dermis grows, and then new epidermis grows on top of that. So what you're doing is you're creating more collagen in the face, and you're growing new skin to cover all of those holes. So brand new skin is developed. When we treat in the vagina, we are treating through the surface layers into the deeper tissues. Those channels are being filled with collagen and elastin, new blood vessels, new nerve endings, and then the surface of the vagina, the vaginal epithelium, grows anew over all of those channels. So we're turning over and growing new vagina while putting connective tissue, new blood flow beneath. What that results in is tissue function that is similar to before, whatever the tissue injury was that got you to where we are at this particular point in time. So once again, the laser is minimally painful with a topical anesthetic. The procedure is less than 4 minutes. There is no downtime. You can drive yourself to the appointment and drive yourself home. It does not require any sedation of any kind. So I hope we've answered some of your questions about what diVa by Sciton is, what it treats, and what you can expect if you have a treatment. So I'm confident that we can help you. We are here to help. This is our job. It's what we do. We've helped hundreds of women with their sexual function with the diVa laser and improving the pelvic floor as well as urinary incontinence symptoms. So please give us a call. We'd be honored if you choose to allow us to help you and care for you in this manner as well, or visit our website. Thank you.